Hi, my name is Greg Mundis. I live in La Jolla, California, and I'm a spine specialist, and here to talk to you today about adult spinal deformity. Where we get bone from to perform the grafting for your spine procedure really depends upon your surgeon and what techniques they choose to use. Traditionally, we've frequently harvested bone from the pelvis to get the fusion that we need to in the spine. However, over the last decades, we've sort of migrated away from that technique and are now adopting more techniques of using your bone harvested through the same skin incision where your scoliosis surgery happens, and use that bone that we put back in for fusion, and sometimes we even use cadaver bone to help us in times where we need more bone than we were able to harvest. Blood transfusion are actually pretty common in this operation. So before you're ready to undergo the surgery, you need to make sure that you are okay with the potential that you will need a transfusion either during the operation or sometimes just after the operation. This is really, again, dependent upon your requests and your relationship with your surgeon, but really our role is to protect you and to make sure that you heal most appropriately. Sometimes we can actually use blood that's harvested from the operation itself that we can collect and clean and then give it back to you, so it's actually your own blood that's going back in. On occasion, however, we do have to use donated blood to get your blood counts to where it's safe. To know if your bones are strong enough to withstand the spinal implants that are needed for your adult spinal deformity surgery, several things will happen. The first will be a thorough interview with your surgeon. Well, he will likely investigate your history and find out if there are any red flags in your history that would indicate that your bones may be weak. Secondarily, prior to these operations, it's very common to have a study done called a DEXA scan. The DEXA scan is a bone scan intended to quantify how strong your bone is, and then depending on those results, we'll be able to counsel you. So we typically think of those DEXA scan results in 3 tiers. One would be normal, the second we would call osteopenia, where there's some weakness, and the third would be osteoporosis. If you have osteopenia, we'll typically use supplements like vitamin D or calcium to strengthen your bone and do that before the operation and have you continue it after surgery. Should you be one of those patients that has osteoporosis, then there will highly likely be a conversation initiated about how to best treat that, which may require medications prior to you having an operation on your spine. Paralysis is a complication of this operation. It's dreaded. However, I would also say that it's excessively rare, which is a good thing. If it does happen, or if some type of neurologic injury does occur where you have weakness in your legs or numbness and tingling in the legs, almost always this is a temporary result of the operation. We will know that by how the nerve recovery happens in both the early stages after surgery and then how that progresses over as time goes by. We'd like to see recovery happen early because that's a pretty good sign that recovery will continue to happen over time. We see these nerve recoveries happen up to 6 months in the early setting, but also it's not uncommon at all for these type of recovery to take up to 2 years and sometimes even longer, as nerves heal at a very, very slow pace. In order to successfully get you through an adult spinal deformity surgery, a large team is really necessary in the operating room to make this happen. So in addition to the primary surgeon taking care of you, there's a whole other team that's there to support you through this process. This team would consist of a co-surgeon, which is a peer of your primary surgeon. Sometimes there's a resident or a fellow. These are surgeons in training. Other times there's physician assistants or nurse practitioners. In addition to that clinical staff, there's also those that make the room actually more efficient, and that includes technicians and nurses that help to make sure that everything stays safe during the operation. There's also an anesthesiologist that'll be monitoring your heart rate and your blood pressure and making sure that you're safely getting through the operation and staying asleep during the surgery. And finally, there's also usually a neurophysiologist in the room, which is an individual that's been solely tasked to watch the nerve function during this operation to make sure that you get through it safely without any type of neurologic injury. And on occasion, your surgeon may ask for the assistance of a plastic surgeon to help with the closure of the wounds. The reason they would do this is sometimes there's excessive scarring, or the large incision sometimes requires flap coverage of your muscles to make sure that the implants are safely tucked away inside your spine so that they don't become prominent on the outside.